think about getting the stimulus money. There is so much that's going on. And but let's get right to, let's get right to this. Let us get to Dr. Deborah Holden. She's one of our favorites here. There is so much going on with with COVID-19 and with our health care that we just said we wanted to get right to it today. And so I want to thank you all for listening to me. But guess what, everybody? We're up on Facebook. Hey, Marnie and Chapearl. Ooh, we're on it. I'm so excited. I don't know what to do. I just don't know what to do. I'm so glad to be back. I'm glad to see you, Linda, and everybody else here. So, Dr. Deborah Holden, how you doing? Do we have Dr. Deborah Holden up, Paul?
We should.
Uh, Dr. Deborah
You
Holden?
know, I did
Okay, girl.
first day back
I got you.
after my same tricks being brilliant on mute.
No, no, we can't do that. But it's good hearing your voice. It's good hearing your voice. So talk to me. Let me first start with this. AstraZeneca, world renowned maker of vaccines, they have halted their vaccine program in 20 European countries. Now, the Europeans tend to be more skittish about vaccines. In many European countries, children are not vaccinated. So I think that we need to have some
Yeah.
context to this too, right? So talk to me. What should we make of this? Because now, our own government, while we don't distribute it here in the United States, we are looking at giving the vaccines that we do have from AstraZeneca to other countries. Is that safe?
Well, the protocol and the bar for what makes it, through the FDA, through our vetting process, is much higher than you will see in other countries. And so, no, it would not surprise me to know that if they don't cut the mustard here, that we will not see this vaccine out in our community here. And in fact, it's like with the Super Bowl. Do you know that all of this Super Bowl memorabilia and all of this stuff is all done in advance? I found this out the first time, Cynthia, I went to Ghana.
Mm-hmm.
I'm in Ghana, and I'm seeing all these kids walking around with shirts, and I say, that wasn't who won. The other team won. Where'd you get that from? And then I found out that's what they do. They pre-print all this stuff in advance so that as soon as the outcome of the game is determined, they can roll out the paraphernalia. I mean, and so they pre-print things with both outcomes. And then whatever team loses, they just ship that stuff overseas. Because you don't care about wearing the wrong shirt, overseas. So I think that's what we're going to see with this. If AstraZeneca doesn't hit the bar for us, or if for any reason needs to get pulled back, I would not be surprised to see all of that vaccine end up overseas.
Yeah, but why would is
I'm
that?
not saying it's the right thing to do,
Yeah, no,
but
yeah, because
yeah.
my question is that ethical? I mean, because if it is, if we're seeing that there is a problem, and quite frankly, I saw them minimizing this on mainstream media today on CNN. Quite frankly, they were saying 17 million of these vaccines, AstraZeneca, have been distributed in Europe. They've been given, and but only a few dozen blood clot. These troubling medical conditions have come about. I said, wait a minute, one is too many. you know, I mean, I, I think we should all be concerned, right? So I'm trying to find out, just how this works because I certainly wouldn't want uh, the reverse to. I wouldn't want people to do that to the United States. If something doesn't work, you just send it over to me, and hey, Mikey, she'll take it. Yeah, she'll try anything. That's not
Yeah.
right.
Yeah.
What is that? Oh, okay. So I mean,
Well, yeah.
what should we be looking for when we get the vaccine for those of us who will get it? Should Is it important for us to know which vaccine we're getting, and
Well,
can
I
we
do think people
request?
should know what they're getting.
Okay.
you can't really request. I don't. It doesn't really work that way
Okay.
because most people are going to get vaccinated, and it's going to be place based, right?
Okay.
You're going to get vaccinated. You're going to, and now they started to open it up. They've got these mass vaccination sites that are, we're seeing them all over the country. People are using, like in my county, they're doing them at the airport now. Because you can set up a drive-through vaccination site in mass at the airport. Why? Because the airport was already designed for a lot of people to, come rolling through every day.
So what, are they just getting
So
people coming off planes, or do you have to make an appointment and go to the airport?
you still have to make an appointment, but,
Okay.
given that you have supply, the airport was designed for thousands and thousands of cars to come through there daily.
Okay.
A lot of people are doing this. They're using stadiums and arenas. Why? Because these places were designed to have tens of thousands of people at them all at once. They've got parking. They've got, the space inside. They were designed to hold large numbers of people. So these mass vaccination sites are what we're going to see more of. And it would absolutely not surprise me if that becomes the new normal. Like the new normal would be, you will see these mass vaccination sites that will come up, because we're going to have to get vaccinated more than once for this. I can guarantee people that. You'll definitely be needing a booster, and this will likely end up being some kind of either annual or seasonal vaccination. So most people will not have a choice. You will have whatever is available at the site that you're at the time. And, that'll be the choice. That vaccine, choose,
Okay.
But that's okay. The 3 that are out, by all measures, are safe and credible. I've gotten a lot more information on the Johnson & Johnson vaccine because it was so hard for me to wrap my head around that the effectiveness was so much lower. And then, again, good colleague directs me right back to the report. And as I look, I'm thinking, Johnson & Johnson was tested under different circumstances than Pfizer and Moderna. And the big difference is there were no variants that was the exception when Pfizer and Moderna first came out and were being tested. Now, variants are common. So Johnson & Johnson was actually tested. You got to remember, these vaccines are being built off of the genetic sequence of the virus when it first came out. But now it's had mutations. Those mutations have stuck. And now we've got multiple variants. And those variants spread a little easier. Those variants do not have the same, the vaccine doesn't have the same effectiveness for the variants as it did for the original strains. And Johnson & Johnson was tested in the community once these variants had emerged. So it would not surprise me that as we start to see the numbers come out for Pfizer and Moderna, that we'll find that, in fact, their effectiveness is not 94, 95%. It's probably going to be lower because it won't be as effective against these variants from stopping people from getting sick or stopping them from spreading. And it might not be as good at preventing severe illness with the variant.
Everybody, I want you to call me at 773-763-WCPT, 773-763-9278. You can also text us at that number. Thank you, GWC Injury Lawyers, for that opportunity. Do you have any questions about COVID-19? I mean, there's so much more that we're finding out about the vaccines. We're finding out that there's a significant chunk of the American population white Republicans, in fact, or just, I mean, and I don't know if it can be just, I think we have to figure out how, I have to find out how they're asking the questions of those people who are, who, who have said no to the vaccines. You've got a significant chunk of the U.S. Congress who are saying no to vaccines. And I just like to know um, how many people or what percentage of the country needs to get this shot or these shots in order for us to return to some kind of normalcy. I've got 2 minutes.
That's an interesting question because, this concept of herd immunity, it has some conditions that have to be met. So, most people are saying it needs to be at least 70, more likely 75% of the population will need to be vaccinated. Natural immunity does not appear to last as long. So, adding those people in is not the wisest thing to do because their immunity is much shorter lived.
So what does that mean?
It appears to be.
What do you mean about natural immunity? What?
So natural immunity is what people develop if you are infected and then recover.
Okay.
So a lot of what the vaccine will do, your body does that anyway as a part of its recovery process. So you will get exposed to the virus and your body will mount an immune response. And that will include, developing antibodies and tagging the virus and sending out helper cells to help fight it off and, all of that. And so, um, it's like with anything, once you've been exposed to it, it's like training day. Your body has some experience on how to fight it off. It doesn't appear as though those antibodies that you get when you actually are infected with the virus last as long as the antibodies that you get when you're vaccinated.
1 minute.
Well, let me ask you this. I've got less than a minute here. Does that mean that is it synthetic? Well, when we come back, then let me ask you that about the vaccines themselves, the shots themselves. If the natural immunity doesn't last as long, then what is being used to boost your immunity? I mean, is there anything synthetic in any of these drugs? I mean, I want to find out because I'm
30.
just asking a lot of questions because I think that people ask me questions and I'm like, I don't know. I'm not Dr. Deborah Holden. That's why you're here right now. So let me. I mean, they genuinely come to me and
15.
ask me. So Santita, what do you think? I'm like, honey, I have no idea. Let me get Dr. Deb on. We'll be back with more of the
10.
Santita Jackson Show in just a few minutes. 773-763-WCPT and
5.
WCPT 820 in Chicago and AM 950 Radio, Minneapolis, St. Paul. Back in just a few minutes. Hey, hon, how are you? Good.
Good. Yeah.
Good. I'm sorry.
No.
I had mad problems trying to get on this morning, but I'm so glad that I'm back.
Are you on StreamYard?
I'm up on StreamYard finally. I couldn't get on for a long time, but now I'm on, and thank goodness for that. Just got a lot to do. There's a friend of mine who is helping to start a fund where he's trying to bring Black people and people of color and women in so they can get capitalized for their businesses, which is great, right?
Yeah.
And so that's no small thing because Black women in particular took such a big hit in this pandemic. Everybody like and share. I'm so glad to be back with everyone today. Bab Baleli. See your mom got her shot. God bless you. Let me know how she's doing. Linda, how you doing? Um I should be on YouTube now, Linda. So everybody, I should be on YouTube. Shirley from Philadelphia lost one of our dearest friends in the world in Philadelphia. Shirley, you probably knew Emma Chappelle. Um, and I'm dedicating the show to her today. And when I get back on there, I will say that Dr. Deborah Holden. She's one of the few African American women to ever start and have her own bank. The bank is no longer in existence, but she had been quite a trailblazer for Black women in corporate America, and certainly, and particularly in the banking industry. And she made her transition a couple of days ago. She was one of our biggest supporters, one of our dearest friends, and just broke my heart a little bit. And she was Philadelphia. In fact, she had a radio show on WURD, which is where Charles Ellison and all of our friends up in Philly are. You know, I can hear something in the background, Deborah. I don't know what that is. Okay. So I got that. So we're good. But I just, Shirley, I'm thinking about you all today because I've got a lot of beloved people in Philadelphia. Told you the first time I was ever on radio in my life, um, Deborah, was in Philadelphia. One of my godmothers, uh, Mary Mason, who was like the queen of radio in Philly. I was my father was speaking there, and I spent the night with her. I was so excited. I went to work with her that morning, and she put me on the air. I was like 6. I was like scared to death.
Mm.
Like, and Aunt Mary would never take no for an answer. God bless her. Mark, how you doing? And Paula, hey, hey, hey. Melissa, how you doing? Good morning, Louise. And Vicky. So now, where do you want to go with this? You wanted to go into the
1 minute.
stimulus. Thank you. You wanted to go into the stimulus. I wanted to want you to respond to me about what's in the vaccines, and then you said you wanted to talk about the stimulus. Do you want to continue? I need you. I would recommend that you say something about mandate equity. Okay.
Yeah, sure.
Okay. Just make sure every time, every chance you get to push that, always do that. Okay.
Yeah.
Okay, and we can do that at the top because I'm going to be bringing on someone from Public
30.
Citizen who's talking about mandating Medicare for all. How about that?
Well, I'd say if it's not a law, if it's not written, if it's not enforceable, if it's not attached to resources, it's not happening.
15.
I got you.
And
I
we
got
need
you. No, but
legislators to do what they do, which is legislate.
yeah, I got
10.
you. And then we
Make
have
it
to
a
do it.
law.
We have to do what citizens do. We have to push, right?
5.
Hold on.
Yeah.
That's what we got to do. Hold on.
This is the Santita Jackson Show.
Hey, everybody. Welcome, welcome, welcome to the Santita Jackson Show. Thank you for being so patient with me this morning. We are up on YouTube on the Santita Jackson Show. So, everybody, Robert and Francis and Dawn and Bab and Carol out there in California. Yeah, I'm back, girly. Yolanda, Daphne, everybody, Blu-ray. Please go on over. Well, Blu-ray's already over there. Renee. So, everybody, please go on over there and like and subscribe. Like and subscribe. And L. Stanley Davis, God morning to you too, my sweet. Barbara Bacon out there in Oak Park, Joyce Anderson, and everybody sending you much love this morning. Thank you so much for being with me today. And let us get this discussion going with Dr. Deborah Holden on this brisk day in Chicago. We're only going to have a high of 42 degrees today. It's going to be scattered showers in Minneapolis, St. Paul, 50 degrees, partly cloudy, but it's raining all over the country. They're having a lot of thunderstorms and tornadoes. So we've got to pray for our brothers and sisters all around the United States because they're having some tough weather right in through here. Dr. Deborah Holden, on the other side of the break, I was asking you about, you talked about natural immunity. I haven't heard that one before. And I wanted to know, is there a difference between natural immunity and the immunity that these these shots are giving us? I mean, is there anything synthetic? What's the difference? Or is there a difference?
Well, in both cases, and just so we're clear too, this is not unique to the COVID vaccine.
Okay.
It's not. A lot of vaccines have that effect. The immunity that you'll get from a vaccine will be more robust or longer lasting than the immunity that you'll get from infection and recovery. One of the good things is, and this is actually being tested right now, is it looks like for people who've already had COVID, if they seem to get a lot more protection, even just from one dose of the Pfizer or the Moderna vaccine, right? Because remember, the first shot is really like a primer with the Pfizer and Moderna, and the second one is really where you start to get that full spectrum of protection. And so it looks like for people who've already had COVID, even one dose of the vaccine looks like provides a whole lot, compared to somebody who's never been exposed to the virus. So that's not an uncommon thing, that the vaccine will give you a stronger immune response, or, will have your body produce more antibodies, or antibodies that will last longer than you will see from somebody who is just exposed and recovers on their own. But that is, in fact, how this works, which is why, remember the guy who said, oh, we'll have herd immunity by April. I just thought that's not going to happen. Like, it's just not going to happen. It assumes that all of the people who have recovered, been infected and recovered, are in the category of people who are no longer at risk for infection. And that's just simply not true. The other thing that we're also seeing is the reinfection cases. Many of them are getting hit way harder than they were the first time.
What is
infection? Yeah.
What is COVID-19? I mean, is it because my first understanding of it, the first reporting was that coronavirus is just that. It is a virus. This gives you COVID-19, which is a disease. Is that true?
Mm-hmm.
What is
100%.
So what does that mean?
So there's a virus, and it's called coronavirus, and I believe this is the 5th coronavirus that we've seen in the human population. Coronavirus is the type of virus that is the common cold. The common cold is the coronavirus. This coronavirus, and it's called coronavirus because corona in Spanish means crown. So if you look at it, the actual virus itself, the molecule, looks like a crown. It's round with little spikes on it, like the way a crown is. So if you were to look on it on a microscope and you would look down, it looks very similar to the way it looks on a microscope. But we've all seen the kind of 3D picture of it with this big red molecule with these, sort of spikes coming all, out of it. But if you look down on it in a microscope, it does look like a crown. And so that's why it's called coronavirus. And those spikes on the outside of the molecule are called spike proteins. So it's just a virus. But if you get exposed to that virus and you get infected with it, and that virus then replicates in your body, then you are considered to have the disease of COVID-19. This is the same thing, the difference between HIV and AIDS. And we developed this term full-blown AIDS, right? There's the virus, which is HIV, human immunodeficiency virus. And that is the virus that causes the disease, AIDS, which is acquired immune deficiency syndrome. The line between just being HIV exposed or HIV positive and AIDS is the level of sickness that one has. And there are a lot of people who will get exposed to the virus and won't really ever express a lot of the symptoms, or you won't see a lot of the impact of the virus in their body. So they're not considered to have the disease, but they are HIV positive. Same thing. There'll be people who get the virus, get exposed to it, but won't express all of the signs and symptoms of the disease.
Okay. Well, then let me ask you this. A lot of people are getting vaccinated. I think that 12.5% of the American population thus far. Long way to go to achieve herd immunity, but, people are moving forward with the vaccine. And yet, there are fears from officials, from public health officials, and from those who've been elected to serve us, that with this reopening, because now more and more states are fully reopening, or they're having robust reopenings where you can have 25, 50% capacity in public spaces, if not 100%. And a lot of people who've been vaccinated feel that they're free and clear. Uh, I mean, even though they've been told not to mask, I've just seen a lot of people who I've been vaccinated, so I'm okay. What do you say about that? I mean, because we're seeing up in Michigan, we're seeing a spike, and we're seeing spikes in various states all around the country of an infection spike. I think, according to one news report, in 14 states.
Yeah, the problem is the vaccinations are not able to keep pace with both spread and with these variants. Because remember, the vaccines don't appear to be as effective against the variants. It's not that they're not effective at all, but they're not as effective with the variants. And so, yeah, we're doing an amazing job of getting lots of people vaccinated, every day in lots of different cities and lots of different states. But that has to keep pace with the spread of new infections. And we have to go a lot faster and do a lot higher volume of vaccinations daily for us to keep pace. And it's unfortunate. I just thought, Americans are just so pig-headed. Opening prematurely is only making things worse. And don't get me wrong, I'm over all of it. I'm where everybody else is. I'm tired of COVID. I'm over it. It done got on my nerves. I'm tired of not being able to travel. I'm tired of not being able to be around people. Over being around people and then don't really feel comfortable hugging anybody, kissing anybody. I mean, human beings, we're touchy people. We touch, we hug, we laugh, and so to not be able to do that has been awful. Mm-hmm. And at the same time, especially with the vaccine coming out, we're like so close to being able to resume some sense of normalcy. But for people to be reopening now and to be fully open, it's terrible. Because remember, variants come when this disease spreads. So the more this virus goes from person to person, the more mutations we'll see. The more mutations we see, the more variants we'll have. And the only way to get things back on track and back to whatever normal is going to look like for us is we've got to slow the spread. So, states like Texas and other states reopening the whole state, everything business as usual is just a mistake. It's a mistake.
Let me ask you this. Is there a larger conversation going on is there different people in your community, virologists, immunologists, microbiologists, who have a different view? For example, some of them believe that being isolated from each other suppresses your immune system, that being in lockdown is not helpful to us. I mean, that's a school of thought. Um, and I want to know, is there a robust discussion going on with people who have different points of view about how to manage this crisis or just how to deal with it?
I don't necessarily think these people are talking amongst each other, right? There's sort of no vehicle platform for that. But I mean, if I just look at how other countries have managed this, look at China, where this started. Much more densely populated, much higher population. They've got it under control. Look in Canada, our neighbors to the north. I mean, if you just look at how other people manage this, see, the problem is you talk about lockdown, we've never been in lockdown, ever. We've never had a full-blown lockdown. We've had these feeble, half-hearted, semblance of being in lockdown, but we've never actually gone the full Monty. We've never had it be that only essential personnel could move about. We've never done the actual mitigation steps that would have had us get this under control, months in, instead of here we are more than a year later, still very much in the throes of dealing with this. So yeah, like this can't. I don't think this would be a good way to be for years and years. But we've never gone the full Monty. This is just the very nature of Americans. You know, every people walking around, they know their rights. They want to make America great again. They, you know, just all these different ways of viewing the world, and then people exercising those views or those freedoms and choices related to their health. You know, not masking became a political statement.
But wait a minute. Dr. Fauci told us initially that we didn't need the masks. Because I think people have gotten,
Yeah.
and you know that different people have. Dr. Birx told President Trump that this would be over last spring. President Trump didn't come up with that himself. I'm not an apologist for him, but I know the people who are the scientists, the people who have the information, they weren't giving the information. China won't let the World Health Organization in so they can find out where this originated, just how this came about. I mean, a lot of people who are in charge here have not given us the information that makes people feel comfortable following you. Plus, you're living in a time which preceded President Trump. Quite frankly, you saw it when the housing market collapsed in 2008, where people just stopped trusting our institutions. That happened really after Kennedy was killed, because nobody felt that they were being told the truth, and it's just gotten worse over time. So I mean, because I think it's it's not just it's transpartisan. It's beyond Republicans and Democrats and blacks and whites. A lot of people are looking and going, "What is going on here?" And which is why I have you here so we can so we can kind of get at the truth. I mean, that's why I think that $1.5 billion is in the stimulus package, so that there can be a rollout in the churches. I'm wondering if that's going to work, Dr. Verholden. I mean, do you think it will?
Say that again. It's a what in the churches?
A rollout to get ministers and to get churches involved in convincing people to get vaccinated.
Well, we have a lot of that in Flint and in Genesee County.
Okay.
The churches are less, I think, though, it's less about having the churches convince people to get vaccinated and more about accessibility for those who choose to get vaccinated.
No, I think it's
both.
both.
Because for us,
it's both. It's both. I mean, because that's the reporting that because your credible messenger is the minister, right? And so your pastor, is because they know they're trying to move the needle on those who are not just hesitant, who don't feel comfortable with this whole process. I mean, how do we get from where we are to where we need to be? I guess that's the bigger question.
Well, I mean, you got to deal with the real barriers that people face, right? So for some people, the barrier is they can't get on a wait list. So we've got lots of things to help people with that. Multiple ways for people to get on besides just going onto a website. Then there's a lot of people who don't seem to be able to get off the wait list. So they're trying to deal with that. And don't get me wrong, I think we've done a very, very poor job of all of this. Hence, I am on the push to mandate equity. I personally know and believe that in the absence of any requirement, any bottom line requirement, that people demonstrate that they can and are getting it to people who want it fairly and equitably, we'll continue to have this all over the map response where some people seem to have ready access. There are people who signed up and the next day are getting vaccinated. And then there are people who've been on a wait list for a month and a half, 2 months. There's still all these people in category 1A, senior citizens and frontline workers who've not been vaccinated.
Well, let me ask you this.
And in place, yeah.
No. I mean, because every time you say something, it prompts another thought. Everybody doesn't have access to the internet. If you don't have access to the internet, how do you get on the list?
Yeah, there's no one answer to that. A lot of states and different cities do it differently. But most places now have a number that you can call. And what happens when you call that number is there's somebody who then puts you on the electronic list. And I really, really, really want to, somebody campaign. I really, 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 really want that. Because the common theme for people who are able to get the vaccine, especially if they're either not in an eligible category or their eligibility just opened up. But because technically, when this eligibility opens up in a lot of places, it's not eligibility to get vaccinated. It's eligibility to get on a wait list. But a lot of these people are getting on a wait list and then getting vaccine right away. And so, the sort of gap is about, getting people on, and then once people are on the list, getting them off of the list and actually getting them appointment and getting them vaccinated. So, and like in Maryland, they've opened it up. So I've been monitoring my Facebook, and I've been shocked to see how many of my otherwise healthy and, normal, 30, 40-year-old friends have been vaccinated. While I know for a fact there are still people in category 1A and 1B who are stuck on a wait list. I think that those problems hopefully will be resolved in the next month or so. But again, it doesn't make sense to me why this resource was rolled out with no requirement or no conditions attached to it. It doesn't make sense to me. So, the fact that you've got, in our state, so much missing data on the race of who's getting the vaccine, so we can't even say with certainty what racial equity and vaccine administration looks like because, almost half the data are missing race.
So what
that doesn't make sense to me.
So what do we need to do going forward to change that?
Well, I tell people, you voted for people and you voted for legislators. I want to make that real clear. When you voted for your congressperson, when you voted for your state senator, when you voted for your state rep, you voted for a legislator. And we go back to our third grade civics lessons. Legislators make the laws, and the executive branch enforces those laws. So our top executive is the President of the United States. Our top legislators are in Congress. They are in our state houses. They are in our local city halls and in our local municipal buildings. These people should be legislating these things. If something matters here and we say it's important, it should be a law. And then our executives, it's their job to make sure that those laws get enforced. And so I'm asking legislators to do their job and to make legislation, and executives to do their job and enforce that legislation. So to me, we need legislation. We need legislation for the things that we say matter. And if racial equity and COVID vaccination matters, then it should be legislated. And if it's not, then I really question if it is. So mandate equity is a movement that I started about using legislative power and other authorities to affect change. I find it absolutely repugnant that a legislator is going around making a bunch of site visits to vaccination sites for a photo op. Please take your butt back to Congress and write some laws about this stuff. That's what I need you to do.
What does the law need to say?
It needs to say if you want vaccine, you have to demonstrate that you can get it to people fairly and equitably. I think it's very simple. I think the administration population needs to mirror the service population, or at a minimum, it needs to mirror the eligible population until wait lists are exhausted. And what that looks like is you got a grid, and the grid will say, this is who's eligible. In category 1A and 1B, this is what the community of 1A and 1B looks like in Genesee County, for example. And who you vaccinate every week needs to mirror that grid until your wait list is exhausted.
Well, let me tell you.
But when we've got...
Okay.
Yeah.
No. Not to interrupt, but people are coming up with a lot of different points that I think that I'd like for you to address. Kenneth Rush said Tom Joyner wanted to know why there's not a 24-hour vaccination. I mean, it's since they want to achieve herd immunity and they want to vaccinate, well, at least theoretically everybody's not going to take the vaccine, but you certainly want everyone to have access to it. and to be able to go get a vaccine should you choose it. What could be done? What
Yeah.
should this look like, Dr. Verholden? I mean, what is this supposed to look like? I've got 2 minutes before we go.
Well, a lot would be possible, but again, I don't think there's enough real skin in the game. So when you say things like 24-hour vaccination, my thing is this. If this resource that states and want, that pharmacies want, that big box stores want, now they're going to be providing doses to primary care offices and physicians' offices. If this resource that people wanted was attached to some conditions, people would meet the conditions and figure it out if they really wanted the resource. That I know. In the absence of any conditions, and instead they're just being provided this resource, they don't have any skin in the game to figure it out. It actually is a suppression of innovation, in my opinion. Because if people had conditions to meet, it would force people to innovate. It would force people to be more creative. It would force people to develop communities of practice where they're sharing lessons, where counties who are doing it better would then become the sort of source of information and best practices for other places to figure out how to do it better. You know, so in the absence of that, it's going how it's going. So there's a lot of ways that it could look, but there's not enough skin in the game for people to step out on the skinny branches and make something happen that actually serves all people the same. So going how it's going.
Well,
and eventually we'll get there just over time. Yeah.
Well, at the top of the hour, we're going to be talking with public citizen Egan Kemp. Now is the time, as we're looking at this health crisis, this pandemic, that's global pandemic, we're going to be talking about mandating Medicare for all. How about that? Is now should we not now have that discussion? I mean, because now we see a real crisis. We now see that we have people who are not covered or who are not covered enough. If you get COVID-19, you might not be able to pay for your healing. There's a lot going on here. Mandate equity. Mandate equity. Where are we? What is this campaign and what can involve? We got 1 minute.
So the www.mandateequity.org. There will be many different things we'll take on. Right now, we're focused on racial equity and COVID vaccine distribution and administration. And again, it doesn't matter whether or not you've chosen yes for the vaccine or no for the vaccine. The whole point is that for people who do want it, they should have access to it.
Absolutely.
They should have access to it. It should be fair. It should be equitable. So go to mandateequity.org. We have an open letter out to President Biden. I'm doing a great panel with some folks from the Biden
30.
task force and one of his chief policy advisors today, actually.
What time?
Later
Quickly,
today.
I got 20 seconds.
8 o'clock tonight, Eastern Standard Time. You can go into the National Medical Association
15.
website, nmanet.org, and
10.
check it out. 8 o'clock tonight.
Okay.
Myself and
5.
Which is 7 o'clock our time. So everybody go there tonight. NMA, National Medical Association, NMA.net. Right now we're going to ask, should we now have a discussion about Medicare for all? What do you think about that? Back with more of the Santita Jackson Show. I'm sorry, sweetie. I'm pushing. But without getting into it, because we're on Facebook right now, where we're moving with the show, right? Deborah?
Mm-mm.
Yeah.
No, what do you mean?
Well, it's gonna become more tightly produced because we're going to be on yet another platform, right?
Oh yeah.
Yeah. Okay. And so that's why I was pushing, because because this is preparation for television.
Yeah.
So we want to go on and get to it. And plus, when you say things, it makes me think of it. It just brings up other questions, because people have so many questions. And I'm looking, I'm looking here. And hey, Effie Rolfe, and hey, Linda, and L. Stanley Davis, and Tanya, how you doing? She said, a number of my coworkers are waiting for vaccines to be mandated as a way to force employers to provide protections, support for their employees. Wow. You want to talk about Sharon Osbourne? Why, Effie? Why? We can do that another time. But you tell me, Effie, why don't you tell me? Why don't you call in and tell me what about this? I think the talk has been put off television for a few days as they work out this issue with Mrs. Osborne, and they feel her racially insensitive at best, certainly, or racist at worst. Um, Remarks, or maybe people object to her defense of Piers Morgan and her. Clearly, she doesn't believe Meghan Markle's uh, version of events, and certainly she has the right to do that. But you know, I don't know. That's just, I think it's a lot. I think it's a lot. Effie, this is where I am on the whole Meghan Markle thing. I mean, I wish her the best. I really do. And because this is also a family issue, I hope that they work all of this out. I hope she does not talk Dr. Deborah Holden anymore to Gail King. And while she's reporting to Miss King is reporting on the news about what Megan's husband is doing with his brother. I'm like, no. See, with families, you don't do that. You keep your mouth shut and you work you work these issues and relationships out yourself. Um, I'm an American, so monarchy's just anathema to me. It's just not my thing. I don't support it, but I hope that she gets out of it. Uh, what she can get out of it. Now, you do know that given the fact that her son would be the grandson of the king, and the nephew of a king, if his should his uncle ascend, that does not give him a title automatically. You do know that. That would have to be a
Yep.
special exception that would be made. So there was a little bit of, I was surprised that Miss Winfrey didn't kind of, or maybe she didn't know, but you should know, what the line of succession is and what the rules are actually. I'm not mad at anybody. I'm just saying, let's just go on and report the whole thing and let's move on. Because as Americans, I'm trying to preserve my republic. What the monarchs do is their business. I really don't care.
Yeah.
I don't. And if you're walking into that kind of situation, racism, all that's in the mix. And and her whole life she's lived with white people. She was in a white sorority at Northwestern University. I'm not mad about that, but
Yeah.
the Deltas and the AKs are up on that campus. And I'm not saying that because I'm a Delta. I'm just saying, her whole life has been lived not with black people. So I see
Yeah.
us getting more concerned about something it's got me scratching my head. Not too much because I don't want to mess up my hair. You know what I'm saying. So I think I've got Egan Kemp on. Do we have Egan Kemp, Paul?
Yep, that's right. Hey,
Egan, how are you?
good. How are you?
Good, 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 good. I want you to meet Dr. Deborah Holden. Um, she's from Johns Hopkins, but she is with the she wanted to hear what you had to say because we're pushing on. She's mandating she's a world-renowned epidemiologist, and she has gone to Michigan State University. She's helping to build their School of Public Health. A brilliant epidemiologist, brilliant administrator, and he's brilliant himself. Of course, he is from Public Citizen. We love Public Citizen because of their advocacy, and he is their director of healthcare policy. And so we're talking about, as she's talking about, mandating vaccines because people don't have equal high quality access to the vaccines, but we don't have equal high quality access to healthcare. And we need to get
That's right.
that. We need to get that going. I'm like, at this time, this is the time that I think we need to be pushing for Medicare for all. And people should put their foot on the gas and keep on pushing until we break the tape. Now
That's right.
we're
That's
off,
right.
we're off
Yeah. I mean,
Oh no, keep on
yeah,
talking. Ethan.
it's a fantastic time to be pushing for Medicare for all. I mean, I think the COVID-19 pandemic really made clear just where the priorities are in the healthcare system, and that profit over people, corporations over communities, and I think people are waking up to the fact that unless we have a big change in our healthcare system, people are going to continue to struggle, even if they're able to get the vaccine, even
1
if
minute.
they're able to get some, COVID testing or treatment. When it comes to anything else, they're still, struggling far more than any other comparably wealthy country, any other peer nation.
Which is ridiculous. But we're coming up, and so you're going to be saying that and more when we get on the other side.
That sounds good.
Dr. Deb, you still there? Dr. Deb, are you on mute? Deborah, is she still there?
Yeah, she is.
Deborah, for Holden, Dr. Deb. Oh, okay. Oh my goodness. Oh, let me get my glasses. But I'm so glad you're with. I'm so glad you're with me, Egan. I know it's
Back in 10.
you're out there in God's country. Where are you in Utah?
I'm in Salt Lake City.
But I did an album out there with your former senator,
5.
Orrin Hatch. I'm a singer in my other
Oh,
life.
wow. That is too funny.
Yeah,
Yeah, I know that.
This is the Santita Jackson Show.
Hey everybody, welcome to the Santita Jackson Show. I'm Santita Jackson. WCPT 820 is my home, the nation's largest progressive talk radio station, and AM 950 radio. I love my people in the north, the voice of progressive Minnesota. I'm Santita Jackson. It's a pleasure to be back with you today. Call me or text me at 773-763-WCPT, 773-763-9278. GWC and G Lawyers gives you the opportunity to text, and we need to talk about Medicare for all. This global pandemic has helped us to see that we need health care. A vaccine, yes. Therapeutics, yes. Healthcare, Medicare for all. Is now not the time? Or is now the time for us to discuss Medicare for all? We're going to have Egan Kemp from Public Citizen to talk with us about that. And then Dr. Max Wolf at the bottom of the hour. The pandemic has wreaked havoc. It's really just a wrecking ball in the Black community, particularly with Black women, with Hispanic women, with all women, with white women. We are the ones who lost the jobs in this pandemic. We're the ones who lost the jobs. And I mean, Black women absolutely lost more jobs than anyone else. So he's going to be talking to us about those of us who want to be entrepreneurs. Some of you might cook, sew, and do all kinds of things. Have all kinds of gifts that have not been monetized. There are places where you can get money. And there are things that you need to be pushing for legislatively so we can get the support that we need. So let us get to some of these headlines so we can talk about getting Medicare for all because we do need it. Chicago, we're going to have a high of 42 degrees today. Scattered showers. I hear the wind outside of my windows right now. Minneapolis, St. Paul, 50 degrees, partly cloudy. The Dow closed up 189 points yesterday, and they broke a record, 33,000. That's right, they broke that tape. The NASDAQ closed up 53 points. The S&P 500 closed up 11 points. Everybody, what about these? What about Atlanta? We're going to be talking about this extensively on the Santita Jackson Show. What happened in Atlanta? We do know that 8 people were killed. We do know that two were white, but mostly these were Asian women, excuse me, who were killed by a young white man, 21 years of age, who said that he had a sex addiction. So what are we going to do about this, everybody? What is going to happen here? We're seeing that that domestic terrorism, as they're putting it, is a big problem in the United States of America. A racist extremists, according to the Director of National Intelligence, are the most deadly terrorist threat to the United States. What's going to happen here, everybody? What's going to happen? We're praying for our brothers and sisters in Atlanta and all over the country because anti-Asian violence is happening all over the country. Praying for Atlanta today, and we will talk about this more tomorrow, more extensively on the Santita Jackson Show. Hijacking of democracy in plain sight, excuse me. The Georgia GOP has transformed a 2-page bill that restricted voting rights for people all over the state, primarily people of color, primarily Black people. Well, guess what? It has gone from being a 2-page bill into a 93-page assault on voting rights. Wow, got to talk about that too. President Biden, although he's not fully on board with ending the filibuster, he said we need to take it back to what was the way this was supposed to be practiced originally. What was it? Well, you were supposed to talk your way all the way through. That's right, like Jimmy Stewart and Mr. Smith Goes to Washington. He said, hey, have people talk their way through because when you stop talking, the filibuster ends. How about that? Everyone in, nobody out. Jayapal and Dingle, these great congresspersons are introducing the Medicare for All Act with 112 co sponsors, which brings me to our guest today, Egan Kemp from Public Citizen. Let's talk about Medicare for All. What do you think about that, everybody? We are looking at the vaccines and the access that many people are jumping the line. Many people are getting the vaccines before those who really need them get them. Um, and therapeutics. No one's talking about that because those therapeutics are what we need also. Well, let's talk about Medicare for All because while we do need therapeutics, while we do need vaccines, we need Medicare for All. Every American needs equal access to equal high quality education. They should not go into debt. You should not go into bankruptcy because you're sick and because you're trying to get well. Egan Kemp, Director of Healthcare Policy out there in God's country in Utah, got up real early for me this morning. Thank you so much from Public Citizen.
Yeah, thank you so much for having me.
Oh boy, thank you so much. We love the advocacy that Public Citizen does for all of us each and every day. Why the push for Medicare for All now?
Yeah, I mean, Medicare for All has been growing in sort of its ascendancy in the policy debate and in the grassroots movement. I mean, people really understand the need for health care. They look at what other countries are doing, comparably wealthy countries that are spending less than us but covering everyone and guaranteeing access to health care. And Americans just continue to struggle to get the care that they need, or they go bankrupt trying to do so. And COVID-19 really changed the discussion because all of a sudden you have even Republicans voting for bills that ensure that people have access to at least some part of treatment or some part of testing or getting access to the vaccine for free. Well, if we are giving vaccines for free, why can't people get their cancer treatment for free? Why can't people get if they're in a car accident, why can't they get their treatment for free?
You don't get any argument from me. Keep on preaching, my friend, because I'm trying to figure out why we're not having that discussion now when you have people, tens of millions of people who lost their jobs last year, Egan Kemp, Public Citizen. And we know in America, your insurance is key to your job. So you have a lot of people out here who don't who are not even insured in a pandemic. Talk to me.
Yeah, can you imagine a system that's more set up to fail, where during an economic downturn, when 22 million people lose their jobs, a good chunk of them also lose their health insurance, and the ones that didn't lose their health insurance only didn't lose it because they didn't have it in the first place through their jobs. And there's no more absurd time to have an economic recession during a global pandemic and to have all those people now without health insurance, and that's on top of the 87 million Americans, 30 million of which didn't have insurance at all, and 47 million of which couldn't afford the insurance that they had. So they might have had insurance, but their copays, their deductibles, they couldn't afford to even go to the doctor if they wanted to. And because their networks, their insurance networks are so narrow, they may not even know which doctors they can go to. They might have the doctor that they've had for 15, 20 years is all of a sudden out of network, and they're really struggling. And if their hospital was overrun by COVID, all of a sudden they're at an out-of-network hospital and they're facing tens of thousands of dollars in surprise bills. It's just a system that's too hard to navigate, too expensive, and consistently fails the American people.
How would Medicare for All change the fight against COVID? Just COVID. I mean, because people are still dying of heart attacks, cancer, as you pointed out, kidney disease, everything. But how do you think it would specifically change how we have been able to deal with COVID, with this global pandemic of the United States?
Yeah, it would make a big difference. I mean, first of all, just at the most basic, all of a sudden everyone would have access to health care. And we've seen studies that when people, the communities that had higher uninsurance rates had higher COVID-19 infections and deaths. There's some new research that'll be coming out soon highlighting that individual people that didn't have insurance were more likely to delay getting tested or treatment for COVID-19, leading to worse cases and more likely for them to die. And all of a sudden, you would actually have a healthcare system that could could be intervened upon, that you could have the federal government be able to move quickly. I mean, the parts of the federal government that were able to move quickly were traditional Medicare, were some of the Medicaid stuff, and then IHS and some of the TRICARE for the military and VA for veterans. But everything else was sort of a careful dance because the folks that make profit off the healthcare system didn't want to lose this opportunity for profit that is COVID-19. And so they moved slowly. If they did move quickly on anything, it was just to make sure that they were able to maximize their profit during this time. And all of that stuff would go away under Medicare for All. It would be a not-for-profit system where everybody's in, no matter which doctor you was nearest to you and wasn't overrun by COVID, you could go to because you wouldn't have to worry about in-network versus out-of-network. It would just be a much smoother system. And it would mean that American people would be in better health because you wouldn't have so many with unmet needs or going without the care that they should be getting. And so our American people wouldn't be struggling already and then just be hit so hard by the COVID-19 pandemic, which is something that we saw was far worse here than in other comparable countries.
We're talking with Egan Kemp. He's the Director of Healthcare Policy for Public Citizen, one of the great advocacy groups in our country for our rights and for access to all that this country has. I mean, you've written this wonderful report. I mean, it's so thorough. Unprepared for COVID. Let me just start there. Unprepared for COVID. You point out the gaps in our healthcare system that left us so vulnerable in this global pandemic. Please explain.
Yeah, I mean, the healthcare system was never set up to provide care. Our healthcare system was only set up to provide profit to the corporations that pay off our politicians. And so until we have a healthcare system that's really directed towards making sure that Americans get the healthcare they need, we're always going to struggle in sort of a major pandemic. Things as simple as, inadequate public health prevention and primary care funding, and things as detrimental as 400 years of institutional racism contributing to a system where all of a sudden, people are surprised that there's huge disparities in COVID illness and death, but this system was never it was never created in an equitable way. It took steps like Medicare even to just integrate hospitals. And so until we have a system where people's health is the focus, we're always going to struggle and always going to be behind the ball, whereas other countries that built their system on a foundation of equity first as opposed to profit are in a much better position to move quickly and to engage folks across their nations. And it's something that we should be aspiring to do. There's no reason that profit should continue to drive our system and pervert the incentives for healthcare.
Everybody, call me at 773-763-9278, 773-763-WCPT. Is it now time for us to have Medicare for All? I mean, we've got a $1.9 trillion relief bill, the American Rescue Plan. We are looking at rescuing Black farmers. I saw this right-wing screed against Black farmers. Black people were brought to this country to be agriculturalists. I mean, come on. That's what we do in part. And so what about getting Medicare for All? How would that change the rollout? Think about that, everybody. Think about it. How would it change how we live? Because even if you get the vaccine, you could still develop COVID-19. You could still be ill. Can you afford to pay for it? Egan Kemp, people have gotten bills, medical bills, hospital bills in the tens of thousands, if not hundreds of thousands of dollars once they've had COVID-19. And they're saying, I can't pay for this.
That's right. It's been a time where the corporations have known that they can continue to make profit. I mean, insurers right now, they're still charging their full premium, but most people aren't able to get the elective procedures or are justifiably afraid to go in and get elective procedures for the risk of COVID-19. And it's not a fair system. I mean, depending on where you live, you might have better access to care than others. depending on what your state has done, there may be more regulations on the corporations that are trying to take every last dollar from you. And one of the things that we're seeing, and this was sort of, particularly concerning in the nursing home industry, is that you've got, Wall Street fat cats, that private equity companies buying up nursing homes, slashing the staff, stuffing more and more people in a more and more run-down nursing home, and then being surprised when COVID strikes. And because of the low pay for a lot of these workers, in nursing homes or in home health care, they have to work 3 or 4 jobs. All these issues are connected. The lack of a $15 minimum wage, the lack of better pay means people are taking jobs that, then it led to the spread of COVID. So if you're working at 3 different nursing homes, if just one of those patients is sick and you're working with them, you might take it to two other nursing homes. And all of these things are connected where profit is the drive, as opposed to making sure that patients are safe and that there's adequate protocols to protect people from, viral infection.
Would you say that then, given the fact as you open up your study, you said, okay, and it's true, America's not even, we're like 4.5% of the world's population, but we're 25% of the COVID-19 cases. Do you see a direct link between a lack of a Medicare for all program, lack of a national health plan, and those numbers? I mean, it's just staggering.
Yeah, they are staggering, and I do. I mean, I think the Trump administration did truly fail in any sort of coherent effort to address it. I mean, there was always going to be some infections and some deaths, but when we look at the countries that moved quickly, Taiwan, New Zealand, even a number of countries in Europe that aren't sort of island nations and therefore sort of harder to control. Who's coming in and out, there was still lower infections and death compared to what we've had. And even the countries that sort of struggled at the beginning, because they do have national healthcare systems that guarantee access to care, were better able to roll things out more rapidly. Whereas even when we sort of knew, last March that there was, concerns about, what was going to happen in the U.S., the Trump administration moved slow. But even if they had moved quickly, they would have run into so many corporations knowing that they could make profit and knowing that there weren't sufficient regulations to stop them from making profit in a pandemic like this, that it made it impossible for the U.S. system to respond as rapidly, because it's, there's hundreds of companies, thousands of health insurance plans, each with their own network, making it confusing for patients. And if you make one healthcare mistake in the U.S. system, all of a sudden you're on the hook for tens, if not hundreds of thousands of dollars in bills. And so it's justifiable that Americans were afraid and weren't sure where to turn. And because the Trump administration did such a poor job, there was no clear guidance, and it made the whole system worse. And under Medicare for All, it would have been much easier for the government to move quickly, and people wouldn't have had as much fear in terms of where they were going next. And because they wouldn't get any bills, they certainly wouldn't have to worry about tens of thousands of dollars in bills, because Medicare for All would mean no copays, no deductibles, and the assurance that whatever doctor or hospital you're going to will be covered.
Let me go to Melissa. Melissa from Downers Grove. Melissa, I knew you would have a question for Egan this morning. How you doing?
Good morning, Santita. How are you?
I'm doing great. Wonderful hearing your voice.
You too. So I have a kind of question comment. I feel like there's an argument for Medicare for All that is being overlooked, and I would love to hear what you guys think about this. But that is the positive repercussions Medicare for All would have in other areas of our life. And the very specific example that I am thinking of, and bear with me here, is how much less people would have to pay for things like car insurance, because even if they're at fault for an accident that injures the other driver, they won't have to worry about the liability for their health care because Medicare would pay for it. And I think it would require not just giving that, speculative example, but having real numbers behind it, right, based on real research. So people are going to respond to something like, well, you pay $500 every 6 months for car insurance. Well, now you're going to pay $50. Yeah. Medicare for all,
Well, what
as
are
I
the
just made up this
what?
number.
No. I mean, I think you make a great point. Before I get to Christy, what about the broader economic implications of having Medicare for all, Ethan? It seems like it would impact all
Yeah,
areas of our
no,
lives.
it would. I mean, and I think that's one of the most important things to think about. And I think the example you give is a good one. And I think there's a lot of other ones as well that where we just don't think about. I mean, Santita, you were just talking about entrepreneurship. Well, there's no other thing that is harder for entrepreneurs than getting health insurance. I mean, I grew up with my mom managing and owning small toy stores. There's not a lot of money in small, finely crafted toys. And so she always struggled because she couldn't provide health insurance to her employees. And it was something that was, really hard for her and affected her ability to expand her business. And with Medicare for all of a sudden, every entrepreneur, everyone who's self-employed, everyone who wants to sort of, try turning that dream that they've got, they're sick of their desk job, they want to go and pursue their passion, all of a sudden, health insurance would no longer be a concern because under Medicare for all, you would have coverage from cradle to grave as opposed to from job to job, and you could finally pursue. It would change so many people's lives in so many ways. And we only have to look at sort of how much of a struggle it is for Americans to get, keep, and use their health insurance, whereas under Medicare for all, it would not be a concern.
Christy, I only have a couple minutes from Plainfield. How you doing, Christy? What's on your mind?
I'm good, Santita. How are you?
It's great hearing your voice.
Thanks. So I actually work in healthcare, and I 100% believe we do need a national healthcare plan. But I have a couple of questions for your guest, and that would be, we have a saying that Medicare don't care. We have a hard time getting patients certain things covered through Medicare that they need. And just in general with the insurance companies, they are totally for profit. And we have to get referrals for so many things. How would a Medicare for all plan address those issues?
I've got 1 minute. You got it.
Yeah, that's a great question. That under Medicare for all, so one of the things that we always specify is that it's improved and expanded. So we improve Medicare by adding a number of different things like dental, vision, improved home health care benefits. So Medicare for all is really an expanded
1 minute
version of traditional Medicare, and folks doctors would have a much easier time getting things covered right now than they have to do through private insurance and even through Medicare. It would really be up to the doctor and the patient to figure out what was needed, and then Medicare for all would just pay for it.
Egan Kemp, everybody. On my Facebook page, you can read his report, Unprepared for COVID. I urge you to read it. There is a bill in the U.S. House of Representatives now that's pushing for Medicare for all in the midst of a pandemic. Now, they're saying, the mainstream media, that it won't pass, but it could pass if you push. We could have Medicare for all. We don't have it because we're not pushing.
15.
Come on, everybody. Think about that. Egan Kemp, we thank you for the wonderful work that you do with Public Citizen,
10.
Healthcare Policy Director, and everybody. Unprepared for COVID.
5.
We were unprepared for COVID. Now, let's talk about getting prepared for some money. Those of you who have businesses, want to make some money, let's talk about it because women took the biggest hit in this pandemic. Got to talk about it. Let's get some remedies on the Santita Jackson Show. Egan,
hey, thanks so much for having me.
No, you got to come back. Yeah, out there. Look, I did an album out there. We had a wonderful time out there. We sure did.
That's fantastic.
It was
wonderful. It's a great place. It's funny. I grew up in Montana and then was actually living out in D.C. for about 11 years, and then had to come back due to some family health issues. And so it's been weird to be back, but it is a beautiful place. I do miss living in a much more diverse city, though.
Well, you can't have everything, but it's so beautiful.
Exactly.
And I really had a wonderful time when I was there. I really did. I mean, everybody was so lovely, starting with Senator Hatch, who I adore. I know politically, and I don't.
He is a character.
And he's a musician, and he loves it. So I was singing the national anthem at the at the Clinton inauguration. And so when he heard me,
Oh,
my brother
right.
was in Congress at the time, and he called him and said, would she like to sing some of my songs? My brother called me and said, hey, and I always admired the fact that he reached across the aisle for his friendships. Just a nice guy.
Right.
And
Right. No, I had interned for Senator Ted Kennedy, and seeing those two sort of chat back and forth was confusing for me, because I always thought of Orrin Hatch in 90% negative tones, and all of a sudden I was like, wait, he and Ted Kennedy are getting along pretty well. I mean, it's fascinating, the things that used to get done but don't happen anymore.
Oh yeah, but he's that guy. I mean, he's a wonderful, wonderful human being, and he was so helpful to me. And send me your address.
Great.
I'll send you the CD. Oh my
Oh,
gosh.
I would love that. I will. That's
We
fantastic.
had a good time because we actually recorded a few projects together. We sure did. In fact, we
Oh,
did
wow.
Chris Willis. He paired me with a young man, Chris Willis, brilliant musician, and we recorded the theme song for pediatric AIDS, and it held for like 20
Oh,
years.
wow.
Yeah, something that Chris and I produced along with Greg Hansen. Wonderful, wonderful people. And Greg Hansen is one of the closest collaborators of David Foster. So you have a lot of great
Oh, okay.
musicians out there.
Okay.
So we had quite a time, quite a time. So
That
blessings
is
to you.
hilarious.
See, I know. Text me your address and I'll send it to you. Why don't you say hello?
Yeah, fantastic. Well, thanks so much for having me on. It was a great conversation.
Oh, I'm gonna have
And
you
I'm
back.
happy to come back anytime.
Oh no,
So, yeah,
I'm gonna
anytime.
call you directly. You got to come back because we've got to further this
Yeah,
discussion.
you've got my number.
Mm.
Yeah, anytime. We've got a lot of work to do, and so I'm happy to join anytime. So I appreciate it.
Well, before you go, I want you to say hello to Dr. Max Wolf, brilliant economist. He's a regular here every Thursday at 7:30 my time, 6:30 your time. Bless your heart, Dr. Wolf. Egan
1 minute.
Kemp of Public Citizen. You consider yourselves introduced.
Good. Nice to meet you.
A pleasure to meet you, sir.
Egan, I got to have you
Yeah, nice
back.
to meet you as well. Yeah, looking forward to it. Well, thanks so much for having me.
Send me your address.
I'm gonna go make myself some coffee and try to fully wake up.
Bless his heart. He's out in Utah, Max. So I have to.
I mean, you're up early. You're up this early every day. I'm not usually up
30.
early, so it's a bit of a shock.
2 a.m.
I'm in New York, so I have it a little bit easier than you guys because we're an hour later already.
You already had time to make coffee.
Yeah, no, he said, wait a minute, you want me at what time? What?
15.
Oh,
It's one of those times I wish I was
10.
person. Someday, maybe.
oh, bless your heart. Thank you so much for
5.
being with us. Can't wait to have you back, Egan.
Yeah, looking forward to it.
Blessings
Talk
and love
soon.
to your family. Hope they're well.
This is the Santita Jackson Show.
Hey, everybody. Welcome to the Santita Jackson Show. We have been talking about on WCBT 820, the nation's largest progressive talk radio station, and AM 950 radio, Minneapolis, St. Paul. I want you to call me or text me at 773-763-WCPT, 773-763-9278. Let's talk about the money. GWC Injury Lawyers gives you the opportunity to text to 773-763-WCPT. But let's talk about this money. Many of you have wanted to talk about the relief package that President Biden pushed through, and that's important. People calling it stimulus. It was actually relief. That's what it is. But let's go back a little bit and let's look at who was really damaged in this pandemic, in this economic downturn, the likes of which we haven't seen since the Great Depression, quite frankly. So what you want to call it? Black and Hispanic women have taken the real hit. So what are we going to do? But let's first look at the hit that they took. Dr. Max Wolf, brilliant economist. Help me. I mean, when the numbers are just stunning, the percentages of job loss. Talk to me. Yeah, tell me what happened.
So at the highest level, there's two kind of huge impact areas that were disproportionately hurt, and then there's of course the large community of folks that are in both, right? So people who earn less than $13 an hour, which a lot of people I think who are more affluent tend to think are like kids or people between jobs or people looking for some odd work to make a few extra bucks. Unfortunately, it's really more like 50 million Americans. So it's not some rounding error. It's actually an enormous population, right? So anyone who earns less than about $13, $14 an hour, part of the reason that the $15 an hour play is such a big deal for a lot of people, by the way, to push above the sort of absolute kind of can't make it level of income. But anyway, so folks who lower earners and then women, right? And so this has just been a very gendered downturn. We have lost most of the female labor force participation increase. So most of the increase in female employment that we earned over the last 28 years in the last year, which is kind of amazing, right? So it's 28 years. It's a generation of gains for women in the labor force. I mean, obviously we hope this is temporary, but has basically been undone in a 12-month run, starting with the pandemic-fueled shutdowns. And I think,
How did that happen, though? I mean, how is it that women, I mean, and wait a minute, white women took a hit too. It's just Black and Hispanic women took the biggest hit of all, and Black women, biggest hit
Mhm.
of all. How did women get wiped out here?
So partially it's the social safety net, which, my phrase for the American social safety net is there's always more room in the underclass. That's our theory of the safety net here. So, I mean, it's unusual to not find a hole. If you get thrown off something and you're trying to land in that social safety net, it's almost a miracle if you bounce as opposed to hit the ground. So there's obviously some issues there with the social safety net that are non-trivial, but point of care services are heavily staffed by women of color. So if you think about who works in restaurants and hospitals and medical offices and retail stores and point of care jobs, where someone is making your coffee or making a lunch or bringing the lunch to you that was made in the back of the restaurant, daycare centers, schools, the educational employment complex, and the retail complex are disproportionately large employers of women, disproportionately large employers of low-wage workers, folks who make under 15 an hour, and those areas of the economy have just been kind of savaged, right, by people with no money to go shopping, people afraid to go out into public, people who the various shut down, so people can't go even if they want to go, and this wholesale move to no more restaurants, just delivery. That's all guys doing the delivery and mostly guys in the kitchen. So the heavy female employment gets cut out. If it's, hey, we're not going to the retail stores anymore, we're going to order everything online, it's just likely to be guys in the warehouse and guys doing the delivery, males doing the delivery, males doing the warehouse work. Not all, there's some gender integration there, but it's disproportional, right? So if you're losing jobs in the disproportionately female areas, and if you're gaining jobs in the male areas, that's going to be a problem. And then the other big problem is, as a society, we still have a lot more to go. The general assumption people make is that childcare is the responsibility of the woman. And when all the daycares and all the schools are closed, that responsibility falls very heavy on somebody. And because of the lack of social services and help around this, it just means that millions and millions of American women are locked in the house, hoping they don't get sick, hoping they have health insurance, try to take care of one or more children, which is itself, more than a full-time job. And so that can pull people out of the labor force as well. So there are a lot of reasons, but where this burden fell disproportionately was lower income earners and women. And of course, if you look at the sort of double shaded area of the Venn diagram, the two circles, you're going to get a lot of women of color bearing the brunt of childcare and the sudden absence of employment opportunities. And then the last thing I'd mention is, if you make less than $15 an hour, there's almost no way you're ever going to be able to save any money, right? If you can actually make the money and the month last the same amount of time, it's a slight miracle. So you're probably not going to have much savings, which means if you suddenly lose your job, your ability to support your family is extremely impacted.
We're talking with
So
Dr.
it's a lot of hardship.
Hey, it is, I mean, and it is just stunning when you look at the numbers. We're talking with Dr. Max Wolf, brilliant economist, about who was hit in the pandemic. Black and Hispanic women are not sharing in the market recovery even. We lost more jobs than anyone and than everyone.
Asians were hit super hard too. We might
Yes.
mention it's a smaller group, but the Asian community. So before the pandemic, the Asian community had the lowest unemployment rate, lower than whites.
Yes.
And at some points in the pandemic, in some parts of the country now, it has the highest.
But
And that looks to be a
is that
invigorated racial bias against Asians and
because of
concentration in the restaurant and hospitality, you know, nails and salons and restaurants and retail.
because we're seeing this anti-Asian wave of hatred. Oh, is that would you say that's part of the reason that that the Asian community has been hit so hard?
Sure. So like any given job loss, who knows, right? So we're talking about social averages here, but having the president go on TV and attempt without much scientific validity to constantly try to associate China with the virus has created an environment. And, unfortunately, there are a fair number of folks in the United States who don't need a huge nudge to get over to a situation of pretty aggressive racial bias.
We're talking with Dr. Max Wolf about Black and Hispanic women who are not sharing in the job market recovery. Are Asian American women sharing in the recovery, or are they getting hit in that as well?
I mean, they could. We all hope, right? The recovery is obviously still very much something for the future, but so far, no.
Unbelievable. So, how now? Tanya made the point that women of color serve in these social service jobs, or as you said, jobs in which we are serving and making sure that everything that the trains run on time, if you will. We're serving the coffee. We're with the clerks, with the secretaries. We're on and on and on. And a lot of these jobs are gone. They're gone, and they're not coming back. I mean, this. I don't know what is this recovery going to look like, Dr. Max Wolf, and where can we
partly it's
recover?
up to us, right?
Huh?
So the good news of the recovery, in my opinion, is it's still being decided, right? So yes, some jobs will not come back, some will, but many won't. And then the question is, do we as a society get behind helping people pivot to another job? And again, to take the slogan, which I think is a good one, I hope it becomes a good description of what we do. That remains to be seen. But the slogan is good, Build Back Better, which is, look, we have a lot of essential workers, and there's a possibility that the people who saved our collective lives and risked everything, right? Maybe we can carve out a place for them where they don't live on the edge of abject poverty every day, where they have some job security, some dignity, some access to get ahead at work, to save a couple dollars, to benefits. I think we need that for the social glue. I think we need that to be true to any kind of moral compass that we might espouse. I always find it troubling that people who are so into claiming family values don't think a family needs to earn any value for its labor. It'd be nice to see that solved. But this is a group of people who collectively saved America's life. They did the shopping people didn't want to do. They were the nurses who cared for patients, some of whom couldn't even admit they were dying of COVID while they were, right? They have always been essential and often invisible. And in American history, being invisible is normally a precondition for being underpaid and underappreciated. So we do have a possibility to make this more visible now and to therefore do better. But that very much is the jury is out on that one.
Where do we go from here? I mean, because you have a lot of people. One of the things that's happened in this pandemic, Dr. Wolf, is that people have been pushed into doing work that they might have aspired to, they might have dreamed of doing. Now they're having to monetize their gifts, if you will, because the job that they had, they're not going to be able to get it back, or they might not feel safe. They might not feel that that work environment is a safe place. So you have people who've been designers, who've sewn clothes. They want to monetize that. You have people who are great cooks and they want to monetize that. There are all kinds of things that people do. They might have opened little stores. They, rummage sales, all kinds of things, because the clothes that we needed last year, we don't need now. Is there a way to monetize your gifts? I mean, are there any spaces where people can go to start businesses now? Or should that be an option?
Yeah, I mean, so look, there's a real startup culture in the U.S. It sort of takes different forms and sometimes different names in different communities. But I work in this business, right? So I find it interesting. The startups that tend to get the most attention are the venture companies, venture capital, which is the kind of investor, venture capital backed startups, which tend to be concentrated in the sort of software and technology space, but not always. And there's been a real movement in this space to make it more egalitarian. The firm that I work for, we do work on that, right? So we build artificial intelligence systems that try to rank and sort through thousands of startups. At this point, about 300,000 in our database and about 25,000 investors. And we let you sort of look at the growth and success rates in different lines of work. So let's say you're thinking of going into one area versus another, you might want to know that there's an 86% failure rate in one of the areas you're considering and a 25% failure rate in the others, right? And so that might affect your desire to go into one area versus another. Historically, we have a pretty serious bias issue here in the startup world, the venture startup world. So very few female fundings. So about 4 or 5% of the dollars seem to have been flowing to female founders. It's gotten a little bit better recently, but obviously anyone out there doing a little quick math probably noticed that there's more than 4% of the society is female. So about 51% of the country's population is female at any given moment. In any like society without heavy infanticide, there's a little bit more. It's a little bit more female than male, usually for a host of reasons. But so about 51% of the population, or 50.5% of the population, is female, and obviously less than 1/10 of that population weight, less than 5% of the funding goes to women historically. Again, has gotten better lately. Women of color have also tended to underperform, so they don't get as much even as women writ large. There are some efforts to kind of move beyond that, try to get over that. We make an effort in the firm that I'm at, Systematic Ventures, to try to help people look at all the applicants without any bias. The most successful startups tend to be able to draw on early funding, either from their own savings or from what are called friends and family rounds. And if you don't have friends and family that can give you $20,000 to $100,000, it can be tricky to compete with other people who do. Right. So there's an effort to sort of offset some of that.
Well, because see, let me ask you, what are you doing in your firm? I mean, are there other? I mean, what would make someone a good candidate to get a loan or to get startup funding, and why is it that only 4 or 5% of women get that startup funding? Well, is there something we're not putting on the application? I mean, what is it?
No, there's not much evidence, by the way, that it's something lacking in the entrepreneurial skills of women or people of color. In fact, the survival rates are a bit higher. So if you look at women and people of color, when they do succeed in getting funding, they actually succeed a little bit more at a slightly higher rate than the white male. So the statistical evidence is not that it's like when you fund a woman or a person of color, you're more likely to lose your money. There may be a social perception of that, by the way, so I can't speak to that, right? There may be a fair number of people who believe that that's the case. Statistically, we know that it's in fact not the case. But the bigger issue, I think, maybe even more than getting funded yourself, is in order to build an ecosystem for women of color and women in tech, you need to see women get hired into jobs, particularly higher and technical jobs, because the people who are working in today's successful startups are always the people who go on to start the next generation of successful startups, if that makes sense. Right? So we tend to focus in the US social conversations, which does make sense, on the top of the ladder, right? But think about it. There's 5 million really good jobs in startups, and there's probably 1,000 startups. Those 5 million jobs are where the action is, right? Also because people who are building today's success stories will also eventually go off and start tomorrow's success stories, right? Now, some of this is related to the underrepresentation of women in the STEM fields, where a fair number of these people are drawn. And some of them, I think, are social bias too. I mean, if you start a company, you're going to have low or negative income right? As you use up your savings for a while, and you have to get a community of people who believe in you, and a spouse or life partner who believes in you. And people have to believe that what you do is you help her build the empire. And there's pretty good evidence that she can, and there's very good evidence that people don't make room for that. You know, so there's a culture of everybody support the guy who's going to go build the empire, and those guys can get that support. That can be emotional support as well as financial. There has historically, I think, been less of a culture of, hey, you know, I'm taking care of the kids a lot more these days because my wife is building a company. I mean, it happens, but I think it might happen far less frequently than the inverse. So I think that's kind of important. And I also think that the startup game is a tough game. There's a very high failure rate. So people tend to follow their intuition. And without trying to insult anyone, when people follow their intuition, they often end up making pretty biased decisions. I realize that's not a nice thing to say, and it can offend a lot of people, but the evidence statistically is extremely strong. But if you ask people to follow their intuition, obviously, depending on who they are, and obviously not everyone, what your intuition is often has a lot of social bias stirred into the pot, if that makes sense. So if your intuition is, if you close your eyes and imagine a successful entrepreneur, and 100 times out of 100, it's a guy, then, you know, it might be problematic in terms of your interests to fund a woman, right? If you close your eyes and imagine
Dr. Wolf?
to as well, right? So what my firm does is one little tiny piece of a much bigger puzzle, but we do everything with machine learning. So it's all statistically driven. So the idea is that the personal biases, we can't remove them, but we can lessen them a tiny bit because we're just looking at when when our clients try to answer a question, they use 500,000 data points to answer a question, right? And so mixed in there are white and black and male and female and none of the above and all those categories. And we just don't cut the results that way. So you don't know which results you're getting.
How would we benefit from having a workforce, an entrepreneurial force? How would society benefit from having it feel like everybody in the society? And I mean,
Sure, well,
I'm
I'll
not
start
just
with
saying,
my field.
yeah,
Right?
because I'm not saying not just in terms of color, right? I'm saying, diversity of thought, diversity of experiences. Some of the brightest people did not go to school with you.
Yeah.
All original ideas did not start in the Ivy League, right? No shade, or in
Almost none
HBCUs.
did.
you,
Almost none did. I'm pretty sure.
you
Yeah.
know. So I'm saying,
Yeah.
what is the benefit?
Tuitions and IQ don't correlate that well. So yeah, look, from my business, which is the one that I would know the best because I spend more hours in it, not because it's more important, but just because where I live, so I see it a lot. Upper income white males solve problems that seem important to upper income white males. Right now in the US, we've bet our future on the tech business, and they've done some very good work and some not so good work in a mix, right? But generally been pretty impressive, pretty dynamic. But they're solving problems that seem important to them. The problems that most of the world wrestles with are a lot closer to the problems that women of color face every day in the United States. So if you want to be a global player, you can answer those questions and solve those problems. There's probably more global relevance, right? So we have a tech community that's produced a whole lot of apps that are really good at dispatching a maid to your house or getting someone to walk your dog. Because if you're making $150,000 a year and you're a young person working insane hours in the tech business, that's a real problem and you want it solved. Fine, that's probably for the best. However, we don't do much of any work on making sure that the woman who shows up at your house gets paid a living wage, isn't exposed to COVID because she has proper PPE or he has proper PPE, that the person is treated okay by their employer, that the person isn't sexually harassed or worse in the workplace, et cetera, et cetera, et cetera, right? We haven't done so much work on that because that's not a problem that shows up on that particular radar screen. Likewise, I think there's some interesting work done often by volunteers and public organizations, but we have lots of apps to walk your dog, and we haven't been so good at generating apps on telling people where and how to go get their COVID vaccine.
Okay.
right?
Okay.
I think you could make an argument that finding someone else to scoop your dog poop is less of a socially pressing issue than making sure people get health care. I mean, who knows? I mean, that's just my opinion. But, and then I think the other thing is that the future really is more female than the past. And the future will be dominated, even the US future, let alone the global future, by people of color. So if you're building for the future, you should probably be building for the future population. And you should probably be building solutions that will be meaningful to future needs. And you can't do that without being inclusive. Again, this is not a moral thing, although there's a moral angle. This is just bad business.
It's just bad business. I have 2 minutes before we go. It's bad business. What's bad business, and how do we get from bad business to making good business sense?
Yeah, so excluding a large number of talented people because you've historically excluded them doesn't make sense, and it doesn't produce good outcomes. Competition and the best winning produces good outcomes. If we don't let a lot of people compete, we don't get the best outcomes. So imagine an election in which you were told, okay, these are the 3 people to vote for, and then we celebrated the competition of those 3 people. Sure, we could try to pick the best of those 3 people. There'd be an element of democracy there, although I don't know how profound, but you'd be leaving out the other people who might have wanted to run, right? And you don't know, you can never know. You may have the best candidate, it's possible, but you don't actually know because you haven't let the whole field race, right? So I would say what we have now is a little bit like what we had in professional sports when they kind of had the white league and the Negro league, right? And so the guy who was or the team that was the world champion team and the greatest MVP, maybe, right? Maybe, but maybe not, because there's too many people who can't play. And I think American professional sports, in many cases, wouldn't have the global fan base and the global supremacy that it has in a lot of areas if we were still excluding a whole lot of people from getting on that playing field. And I don't actually think entrepreneurship is intrinsically different.
Just ideally, in a couple of minutes, well, really in about 90 seconds, if we let everybody in, nobody out, that is to say, the law of attrition is what it is, but if we opened wide the gates and had equal access to equal high quality opportunity, education,
we have to do more than open the gates.
Okay.
Yeah, so we have to do more than open the gates, because you can't open the gates one day having shocked everyone and shot at them who tried to pass through the gates for 200 years, because people will be weary of those gates, right? And for understandable set of reasons. We have to actively go out and try to get applications, ideas, solicitations, right? You have to make an effort.
1 minute.
Because if you've made an effort to exclude people for a really long time, it is enormous progress and wonderful to stop making that effort. So I don't want to belittle that. That's important. It's necessary but not sufficient, as we say in mathematics, right? Yes, you have to stop. If you tear gas job applicants, there's a chance they don't come back. So obviously stop doing that, but you have to do a bit more, right? And one thing you do need is try to have inclusive boards, and we have tried to do that.
30.
Where people can see people who look like them succeeding in your organization, right? Because if people can't see anyone who looks like them or see anyone who looks like them who's in a senior position, it becomes hard for them to imagine that they have a path there.
That's right.
15.
So, I think it's a social commitment. I think it takes a while. I think it's very doable, and I think it's hard
10.
at first, and then it picks up its own momentum because it's simply better business.
5.
Well, you said the final word there. It is better business. I'm Santita Jackson, Dr. Max Wolf, and helping us to understand the pathway forward in this emerging America. It's an evolving idea and an evolving ideal. Let's make it work, everybody. Can't wait to be with you tomorrow on the Santita Jackson Show. Like and share, like and share. Love you, love you, love you. See you tomorrow on the Santita Jackson Show.
Thank you.
Dr. Wolf, you are the best. And thank you for making that case.
Dr. Jackson?
No.
I don't know if you want to.
What you say?
I tell her it's Dr. Jackson DDS. She's my dentist.
No, yeah, and I'm not that one.
She says I do my best commentaries during the root canal.
Oh.
I'm the clearest and most useful during dental work.
Look, to see you under the influence, I don't think I'd be able to take it. I don't really like the painkillers. I don't usually take them. No, No,
I think I have a paranoia that you like end up as a vegetable right afterward or something. It's not really based in science, but
no, I'm paranoid. I'm paranoid. Look, I came
it's
out of
my meal
surgery.
ticket, right? I don't have a good backup plan. If I come
No,
out of one of these things a drooling super moron, my employment prospects tank pretty fast.
I don't want to do it. Let me tell you something. I don't want drugs. But I'm sending you much love. I'm going to come off of Facebook now. I'm saying hello to everybody. I love you. I love you. I love you. I'll see you tomorrow. See you right there, Dr. Wolf. See you tomorrow.